Okay, now we're going to do the pelvic patterns. So if you look at the lower extremity patterns, this is our D1 where we're flexed, adducted, externally rotated, dorsiflexed, and inverted. We point our toes down, heel out, push down and out. So your pelvis is elevating and retracting, protracting and depressing. Elevating and retracting, protracting and depressing. For the other pattern, which is the doggy, D2, we're flexed, abducted, internally rotated, dorsiflexed, everted, toes down, heel in, push down and across. We now have just the opposite. The pelvis is depressed and retracted. Coming up here, it's elevated and protracted. Depressed, retracted, elevated, protracted. So for one pattern, we're going to stand here about the level of the pelvis, looking up toward the corner of the table. Our handholds are going to be on the as-is, as the patient pulls their hip up and in toward the belly button. Then we're going to put our left hand on the ischial tuberosity as they push down and back towards me. Pull up and in towards your belly button, push down and back towards me. For the other pattern, we're going to have to switch so that we're standing about the level of the thorax, looking down towards the belly button. And they're going to take their pelvis down and in, and then up and back towards me. So we're going to use the as-is again, pull down and in, and then we're going to take our left hand, put it here on the iliac crest, push up and back towards me. Pull down and in, push up and back. Now there's not as much movement in the pelvis, here guys, as there is in the scapula, so we're not going to see as much movement, but we'll see some. Okay, so you're just going to move back close to me. Start down here with your arm here, and we're going to grab a hold of the pelvis, and we're going to take the tip of your shoulder, the tip of your hip here, up and in towards your belly button, and then down and back towards me. Protraction, elevation, depression, retraction. This one usually feels pretty good too. So for passive, we're going to get a hold of them, kind of cupping the as-is in your palm and cupping the ischial tuberosity in your other hand to passively move her. For active, our hand's going to be on the as-is. No resistance, just do it yourself. Pull up and in towards your belly button. Palpate the ischial tuberosity, push down and back towards me. Pull up and in towards your belly button, push down and back towards me. So now we're going to give you a little bit of resistance. This is where the quick stretch comes in. Pull up and in towards your belly button, pull, pull, relax, push down and back towards me. With the quick stretch, pulling her towards me, pull up and in, pull, pull, pull. And now the quick stretch is going away from me. Push down and back, push, push, push. One more time with the resistance. Pull up and in, pull, pull, push down and back, push. And then one more time, just a couple more times, up and in. No resistance, just hand holds, down and back, up and in, and down and back. Okay, so for the other pattern, we have to shift. We're going to stand about where her trunk is, facing toward her knee. Grab a hold of her pelvis so we can take her through it passively, down and in, up and back towards me. Protraction, depression, elevation, retraction. Down and in, up and back. Hand holds is going to be on the as-is. Pull down and in. Let's try with the right hand. Pull down and in. We're going to put the left hand, hang on, I got to get it there. Left hand on the iliac crest, push up and back towards me. If you do it with your right hand, this is her right leg, we tend to get more retraction and not enough elevation. So you really need to be on the diagonal. Pull down and in, and then push up and back towards me. Up, 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 up. Oh, well, okay. You want some resistance? I'll give you some stretch. Pull down and in, pull, pull, pull. Relax. Now push up and back towards me. Push, up, up, up. Down and in again. Pull, down and in, pull, pull, pull. Push up and back. Up, up, up. A couple times, no resistance, just the hands. Down and in. Push up and back. Pull down and in. Push up and back. Okay, so now we can practice. Yeah, like I